Where's the shoulder pain at?
It goes from here to here.
And then the lower back, can you show me where that's at?
Here into here.
Relax the shoulder.
Earlier I could feel it where I was like off, but now I'm like, okay, I can feel like I'm standing.
Yeah.
Like
more
with my
even.
finger, yeah.
Yeah. There it is.
Hey, yo.
So first of all, okay, let's talk about the pain. So you said lower back pain and then shoulder pain. Where's the shoulder pain at?
Like it goes from here to here. It used to be more in here, but not as much anymore.
Okay, but it's more so in the back area here.
Yeah.
Okay, and then do you get neck pain as well? Where
Yes.
is that usually at?
Like currently, like all here.
Okay.
But in regards to this, I feel it go all the way up.
Okay. Do you get any issues down to the arms and the hands, or is it just kind of just stick right here?
Sometimes I have like pain up here.
Okay. On both hands?
Yeah.
Okay. And then the lower back, can you show me where that's at?
More here. Here into here.
Okay, so it's kind of like throughout the entire lower back, so from
Mhm.
here to here.
Mhm.
Okay. And so you said this has been going on since you were 17?
Yes.
Okay. So you said that basically when you're doing like the dance, it was like you're kind of jolting back. Like.
Yeah, it was a movement. It was a left to right movement.
Uh-huh. Okay. So essentially you were just kind of shifting back. Was that like you said that was the first time you've ever had back pain?
Yes.
Okay. Did you have a trauma or anything before that, like
No.
any injury? Okay. So so that probably was going on, but we'll take a look and see. But so how many years would you say it's been going on now? It's been about.
The last 5 years have gotten worse.
Okay.
But I think it's been on and off before then.
Okay. All right. Well, let's go and get you scanned here. Let me go from the base of the neck all the way up, and then we're gonna work our way down to the bottom here. Okay. Yeah, there's a lot of pressure as we get up to the upper neck here.
Mm-hmm.
And right here. Yeah, so we got a lot of pressure in here. All right, let's see here. All right, so let's take a look here. So I want to start with the lower back first. I want to take a look at the motion of the pelvis. I'm checking to see which joints are moving, which ones are not. So that sacrum or that tailbone, is that tender right there? When I push in there? Not too bad, right? And then we got this right side. Any tenderness when I'm pushing in there? Not too bad. Okay, so I'm gonna work my way up to the top here. So this is gonna be your 5, and we have your 4. So as I push down here, this is 5, 4, and then we have your 5. Any pain or soreness there? Not too bad?
Discomfort, yeah.
Okay.
Not, like super painful.
Okay. Yeah, the higher up I go, it's just really locking up here.
Mm-hmm.
So we're actually going to start with your L5 here. And see if I can take off some of that pressure off of that nerve here, because that's the one that's going to go from your lower back and travel into the glute and then potentially down into the leg here. But when I take a look at that L5, that's not doing so well in terms of the motion here. So relatively speaking, obviously you're having a lot of pain and discomfort. Do you feel like you would have a higher pain tolerance? Do you feel like you do?
I think so. Or maybe I'm just used to it.
Yeah, I think a lot of times patients will start to develop like a tolerance to pain. So as I'm running my fingers down in here, you might even feel this.
I know it's not straight.
Yeah, well, it dips right into here.
Mhm.
Here it's smooth, really smooth here. But once I go into here, there's like a pulling that's like dipping right into this area. This is definitely a chronic issue going on here. Yeah, there's definitely, yeah, you can even tell as I'm doing that, like it almost like it's, when I push in, it takes a while for it to bounce back in terms of the tissue. Like, so here, it bounces back pretty quick, but when I press into that fluid area where it's like edema, is that tender at all?
Yeah.
Hmm.
Even when I get massages, when she gets in that area, that hurts.
6. Yeah. Alright, so we're gonna do that T6 here. Yeah, right there. Is that tender when I press into here? What about C2? That's pretty achy. Okay. Alright. Yeah, sorry.
You found my detonation bomb.
Yeah, I know. Usually when patients want to run away from me, that's the one that we want to do.
Yeah.
Yeah, so definitely as we look at your neck here, so that C1 is not flexing this way. C2, as I look at the x-ray, it's actually rotating to the left, and so that right side's sticking out a little bit more.
Mm-hmm.
So when I work on that C1 here, a lot of times I can clear out that C2. Yeah, right there. So we're going to start with your lower back. We're going to go to T6, and then we're going to go ahead and finish off with the upper neck for you, okay?
Okay.
All right, so let's get you started. Let's go and get you laying on your shoulder, on your side, on your right side here, head here, feet on the other side for me. There you are. Just like that. Good, relaxing that shoulder. Good. There's the rest. That's what I'm looking for. All right. We got it. Whenever you're ready, let's have a seat. Take your time.
I thought maybe I'll grow an inch after this.
You might grow an inch. Maybe half an inch. We'll see. We'll see. But people do tend to stand taller after, yeah. So
that was the part that oh my god, that was needed, that part.
all right, so come on over on this table. So both feet on this table, you're gonna go face down. We're gonna go nice and gentle on this. I know this is a pretty chronic issue based on the swelling in here.
Mm-hmm.
So we're just gonna go and give as much as possible, but we're gonna go nice and easy, okay? Chin up just a little bit. There you go. Breathing in. Deep breath. Let it go. Relax the shoulder. Nice and easy on that. Good job. You all right there? All right, let's have a seat right on over here. You doing okay?
Yeah.
All right. So let's do this last one. It's going to be your upper neck for you. Come all the way back. You're going to bring up your right arm. Arm down. There you go. All right, so this one, it can get a little loud just because it's up by the ears. Mm-hmm. So when we move that, you might hear the popping noises, okay? But it's just the gases, that's all it is. So I'm gonna bring it down just a little bit more. Right there's good, relaxing back. There you go. I'm gonna bring this to the side. Take a look at the motion here. Yeah, definitely that right side. Bring this down just a hair. Okay. Relaxing that, show a little bit of push. Nice and easy on that. Good job. All right. You did it. All right. Not too bad?
Okay, no.
Okay, good. All right, let's get you up walking one more time.
Okay. Well, earlier I could feel it where I was like off.
Uh-huh.
And now I'm like, okay, I feel a bit more like, I think I was really compensating with like one leg felt longer than the other because it was off. But now I'm like, okay, I can feel like I'm standing.
Yeah.
Like
more
with my
even.
finger. Yeah.
Yeah, good. Well, let's go to your exercise. I want to show you what we did. So basically, we talked about how this joint here, how it's kind of pinching back and kind of setting this kind of trend going on here. You got this huge kink over to the right, and then it flares back over here. So this is where we started. Your pelvis is an issue. I am concerned about that, but compared to everything else, this L5 is the one that really stands out the most. That's where the reading was shooting over to the side. We did your T6, and there's some swelling in this area. So we're going to work on that and get some pressure off it. This is kind of where you're kind of arching this way. And then you've lost that curve, and I do believe a lot of that stress is going to be coming from that C1, that's your upper neck, okay? Many times we look at the lower neck when it comes to these reverse curves, but a lot of times we can see that the C1 can contribute to that. So the reading didn't show too much down here today. It might show up later on, but the biggest reading was up on that top part, okay? So we're shifting that joint, shifting it back into the position, trying to get that back into alignment, and hopefully as we do that, we'll clear up some of the other stuff that's going on here as well, okay? Many times I will tell you that when that clears up, some of that stress that you're dealing with in that shoulder, that can start to clear up as well. So we're going to be taking a look at that, see how things are feeling, okay? Any questions? You did good. I'm proud of you. Yeah, you did awesome.